Hello, and welcome to this episode of In Discussion With from Pharmacy Update Online. Today I'm talking to Cindy Williams about the launch of a hospital pharmacy drone delivery service for underserved communities. Could you start by introducing yourself?
I'm Cindy Williams. I'm the Vice President and Chief Pharmacy Officer for Riverside Health, located in southeastern Virginia.
And can you give us a brief overview of your current role, what it involves?
In my current role, I'm responsible for pharmacy operations across our continuum of care. And for Riverside, that includes hospitals, physician offices, and long-term care facilities, including nursing homes, assisted living, and that type of thing. We also have some home-based services, including home health and hospice.
Now, I understand that you have set up a scheme for delivering medicines by drone, and this is what I would like us to talk about today. But first, a bit of background. Could you tell us a bit about Riverside Health, where it is, what kind of population does it serve? Is it just one hospital, and what specialties does it cover?
So for Riverside Health, we've actually been a hospital for over 100 years. We developed into a health system within the last 30 or so years. We have 4 hospitals. We have a mental health facility in addition to the 4 hospitals. We have approximately 800 physicians or mid-level providers across roughly 100 locations of care. And those providers include primary care services as well as specialists. We have infusion suites, we have nursing homes, and we have some home-based services. As far as our geography, we're located in the mid-Atlantic section of the United States in Virginia. We are down towards the coast, and our population goes from urban, medically underserved, more inner city urban, to suburban, and all the way to very rural, with our most rural hospital being located on the Virginia Eastern Shore, which is not connected to the Virginia mainland, except by a 23-mile bridge tunnel. Part of the service offerings that we provide from that location on the Eastern Shore, where we have a hospital and a number of medical practices, is we actually have a primary care location located on an island in the middle of the Chesapeake Bay. And so, as you can imagine, it's a roughly 17 miles from the closest point on the mainland. As you can imagine, it's very challenging to provide care for those individuals who tend to be lower income and medically underserved.
And what drew you to the idea of using drones? Was medicines delivery a problem in some way?
We first started evaluating drone technology really focused on our population on the Eastern Shore of Virginia. One of the challenges that we have specifically in that region is a real lack of public transportation. There is no public transportation option on the Eastern Shore other than a limited van service that simply goes up the main highway that goes from north to south. But if you live in one of the communities that are on either of the coast, there's really no public transportation option, even for those that are medically in need, such as, they don't drive, they have mobility issue, there's just not medical services. The other thing that we know on the Virginia Eastern Shore is that community has a long history of being medically underserved, whether that be lack of insurance, whether that be lack of healthcare providers. And so as we looked at our most vulnerable being Tangier Island, where we have the clinic, we understood that individuals having access to basic healthcare, including their prescription medications, was a need. We also know in that community that we have a higher incidence of certain chronic illnesses, specifically hypertension, congestive heart failure, and respiratory disorders such as COPD and asthma. So when there was an opportunity to partner at the state level initially, the state of Virginia had some limited grant funding for a technology pilot. And so we joined some of our community members and we applied for that and we were awarded. And then subsequently, we were awarded a much larger grant from the US government that allowed us to take the pilot forward and actually perform a limited amount of drone delivery of medications to our patients.
That's interesting. Can we go a little deeper into the funding? Did the hospital have spare money for this kind of project?
Yeah, this was completely funded to this point by either state or federal grants. The initial grant was very small from the state of Virginia and allowed us to really start discussing proof of concept. That's about as far as we got with that particular grant. For the grant process, we did partner with others in the community in order to be successful. So our partners included the local governments, because the grant funding comes through the local government. So we partnered with the 2 counties that are represented on the Virginia Eastern Shore. We partnered with a drone vendor because we do not own drones, nor do we have the expertise to operate drones. So we partnered with a company called Drone Up, which is one of the drone vendors in the United States, as our drone and technology experts. And then we partnered with a research group at one of the local universities, Old Dominion University. And interestingly enough, both of the gentlemen that we're working with on this grant through an Old Dominion Innovation Center had their backgrounds, their careers were with NASA. So they were very knowledgeable, not only about flight, but also around federal funding and leveraging federal funding, as well as project management. And so that became the 4 parties that were involved in the grant process. After we received the state grant, that gave us some momentum to say, we believe there is a concept here, but we will need greater funding as well as support to understand all the nuances around drones, drone regulations, and all of those things. And so under the Biden administration, as part of their infrastructure funding, they developed a platform for innovative technology grants, interestingly enough, under the Department of Transportation. So not everything under these grants was drone focused. I believe in phase 1 funding, which we were able to secure, I believe there were approximately 35 to 40 grants in that, and about 8 of them were drone related. But even with the ones that were drone related across the country, there was only one other that was healthcare focused. And so somewhat of a minority in the type of work we were doing with drones as part of that grant process. And it was a 2.5 or just over 2 year, almost 2.5 year demonstration grant for phase 1. And there will be subsequent grant opportunities under phase 2 in the future.